Hello, my name is Dr. Maeve Kenningham, Dr. K's Clinic, and today I want to talk a little bit about threads. The best way to explain that is for me to open some threads that expired and just show you the instrument itself. So each pack is usually 4 per pack. Now the thread may perish when I start opening this, but if you can have a look here. So this is the device that I use, the thread. So for example, if we just open up here, so as you can see here, we've got a little blue thread, and you can see the end of it that's coming out of a little hole in this blunt cannula. So it's a bit like a long needle, except it's blunt at the end, and on this side there's the thread. So what I do is I put some local anaesthetic, typically. So for example, if I was doing the face, I may, for example, come along here, possibly down here, and then here, and along here. So I would put some local anaesthetic here and here, wait for it to go numb, and then introduce with a needle that's slightly bigger than this gauge, and insert it and create a little hole in the skin right down to the layer that I want to get into. And then with that hole that's present there, what I do is I insert this into that plane and introduce the thread under the skin. Now these threads have got cogs on them, so what you can't see, and it's further along in here, there may be 6 to 8 cogs along here, and these are little, almost like little bubbles along the thread. So and they're shaped in such a way that they catch the dermis, so they you can insert them smoothly, so the cogs are kind of in this direction. And when I arrive here, I then twiddle the thread around, and because the end here will have a few cogs, and that just allows the thread to settle here. And then I forgot to mention what I have here is a syringe, and I have local anaesthetic that I introduce as I'm traversing the face. And then once I've got the thread, so I'll just show you now, the thread then is left inside the face, and then I exit, another little twiddle, and it comes out of the skin like so. Okay, and that creates a little bit of tension, and that's what gives you that little bit of lift. And if you can see here, you may be able to see the little cogs. Yep. Little serrations along there. Oh, yep. Okay. So it's quite smooth in this direction and a little bit more barbed in this direction. So if I was putting in 4 per side, here, here, and again here and here, and then that creates a little bit of a lift, and that's what threads are. Actually, remarkably not. I've had threads myself, and I would say it's actually it is surprisingly tolerable, because as I said before, whenever I insert the cannula, I've got some local anaesthetic which I use to inject, so it's remarkably comfortable procedure to have. A good rule of thumb is if you have quite a heavy face with quite marked folds, probably threads may not work for you. These are not a substitute for surgical facelift. However, if on lying flat in your bed and your folds fall backwards, then it tells me that your facial structures are quite mobile, and that you may get a decent result with a thread lift. They work in two ways. First of all, as I've indicated, they lift, but within about a week of lifting, you will notice that the drop occurs, and that's universal for all threads. But what then happens is, over the course of about 3 to 4 months, is that where the thread has been inserted, your body creates a little network where the thread was, because the thread will dissolve in that time. The PDO threads will dissolve in that time, and it creates a little network of collagen and elastin around that thread, such that when that thread dissolves, your collagen and elastin then lifts again. So it creates a more natural scaffolding, which lasts for a year, thereabouts. It lasts less long with people who have a lifestyle which means that they age more rapidly. It may last longer in those who look after their skin, keep away from the sun, don't smoke, have a healthy diet full of fresh fruit and vegetables. So there are 3 different types of threads. So there is the PDO threads, which are dissolvable. They're all dissolvable for threads, but PDO threads are more short-lived, and they dissolve quite rapidly, usually within 6 weeks. Then there is, but their effects, because of how they rejuvenate, last about 12 months. Then you've got the PLLA -PCL threads, so that's polyl lactic acid threads and polycaprolactone threads, which is a relatively new thing to the UK market, and those threads last around 9 months. So the actual physical presence of them lasts that much longer, and in that time they produce a more prolonged response from your collagen and elastin. So the aesthetic improvement tends to last for about 2 years. And then you've got the silhouette soft threads, which are PLLA threads, and that's more of a semi-surgical procedure. When they're inserted, they need to be done under strict aseptic techniques, because you are inserting, just like in theatre or in surgery, you are inserting a foreign body into the thread, and if that gets infected, it creates a whole heap of hassle. So the problems are if an aseptic technique isn't used, or if there was an aseptic technique but there had been fiddling afterwards. So the aftercare is extremely important with threads. When you're inserting the thread, that it can irritate a nerve, or it can cause a bit of bruising, which is transient. It's a little bit less risky than, for example, fillers, because they won't block arteries. And the more, especially a thin-skinned person, that can sometimes lead to a little bit of puckering of the skin, which is usually transient, a few days, and that puckering goes, and there's often that little bit of a pringing sensation. No vigorous exercise for at least a week. Sleep on your back for the entire week if you can. Strictly no makeup for at least 24 hours. Not to touch the face. Sometimes little threads can resurface, and it's your body just getting rid of foreign body. If that was to occur, you just let your aesthetic practitioner know, because then it needs to be dealt with in a very particular way so that it doesn't cause problems. For example, in the neck, so 2 threads per side start in around 450 to about £600, and that's usually the PDOs, and then upwards for, it's not necessarily a linear algorithm. So for example, if 4 threads per side are put in, it tends to be not as expensive as, you know, 450 times 2, it tends to be, you know, around the 700, 800 mark. But it very much depends on what your aesthetic practitioner tells you that is most likely to give you your best result. I hope that's clear. Any questions, you can always contact me through my website or in the comments section below, and subscribe to my channel for any new videos. I look forward to seeing you once lockdown eases. Bye for now.